Norma verticalis. When we see from above, the skull is usually oval in shape and it is wider posteriorly than anteriorly. The shape may be more circular. Formation of bones. Anteriorly it is formed by a frontal bone and posteriorly it is formed by a this bone is known as the occipital bone, and between the frontal bone and the occipital bone there are two pairs of bone that is called as parietal bone. So the Norma verticalis is formed by three bones. Anteriorly is a frontal, posteriorly is a occipital bone, and on each side there is a parietal bone. These bones are fused with each other by sutures. The sutures lies between the frontal bone and the two parietal bone, that is known as a cornal suture. So this is a cornal type of suture that is called as cornal sutures. These sutures cross the cranial vault from side to side. The next suture lies between the two parietal bones, that is called as a sagittal sutures. Sagittal suture, and the third suture lies between the two parietal bone and the one occipital bone, that is called as, so this shape, this is formed, the shape is lambda. So this suture is known as a lambdoid suture. Topic suture lies occasionally present in about 3 to 8% of individual. It lies in the median plane and it separates the two halves of the frontal bone, and normally it fuses with 6 years of age. So now coming to the features of the Norma verticalis. The first feature is vertex. Vertex is the highest point on the sagittal suture, and the next term is that is called as bragma. Bragma means it is a meeting point where the cornal suture and the sagittal sutures are meet. That is called as a bragma. This area in the fetal skull, this site of membranous gap called anterior frontalis, which closes at the age of 18 to 24 months, it allows the growth of the brain. So this point is known as the lambda. Lambda is the meeting point between the sagittal suture and the lambdoid suture, and in fetal skull is the site of posterior fontanelle, which closes the birth 2 to 3 months of age. So the next is parietal tuber. These are the parietal tuber. Parietal tuber is area of maximum convexity of the parietal bone. This is the common site of fracture of the skull. This is the clinical importance. Next is the parietal foramen. There are two parietal foramen on each side, each of the parietal bone, and it is just 2.5 centimeter to. So there are two parietal foramen on each side. It pierces the parietal bone near its upper border 2.5 centimeter to 4 centimeter in front of the lambda. The parietal foramen transmit the emissary veins from veins of scalp to superior sagittal sinus. So the next point is called as oblion. Oblion is the central point of sagittal suture between the two parietal foramen. This is the oblion. So the next is parietal tuber. These are the parietal tuber. Parietal tuber is area of maximum convexity of the parietal bone. This is the common site of fracture of the skull. This is the clinical importance. Next is the parietal foramen. There are two parietal foramen on each side, each of the parietal bone, and it is just 2.5 centimeter to